Good morning. Happy Wednesday, January 14th. This is Houston's dancing psychiatrist, Dr. Barry G here. Wanted to do a little more update on what I spoke to you all yesterday about, which was generic medicines. So just to recap, generic medicines versus brand name medicines. Go to the pharmacy, they say that they are identical. Once again, that's true and that's not true. The active ingredient in the brand name and the active ingredient in the generic are the same, but the fillers can be different, and the fillers can affect the absorption and thus the effectiveness in some people. Even though when you look at overall meta-analysis, it seems to indicate that brand names and generics are equivalent. That is true for most, but not all medications. I've had tons of patients on multiple medications who, whether it's antidepressants, medicines for bipolar disorder, ADD medicines, which we treat a lot here, who have definitely noticed a definitive difference from the moment they stopped the brand name to the generic as far as the effectiveness. The FDA does give the generic companies a little bit of leeway as far as the absorption, but for most patients, that leeway, that 80 to 125 leeway that the FDA gives, in other words, they allow up to 125% or less than 8 or about 80% of the absorption. For most drugs, the generics do provide adequate treatment, and nobody can argue that if the drug is truly the same drug but just a generic version, cost difference can be huge, and nobody can fight that. But the problem I have is when the efficacy is not there, and that's where sometimes where insurance companies don't want to be able to allow the patient to have the brand name drug, and that's really where I empower y'all to work with your clinician on doing a letter to try to get the appeal, although that doesn't always work, but getting you as the patient getting actively involved in getting what you need, which is clinical relief of the symptoms that are being attacked. I really urge you all to do that. And there are other options. I mentioned a few patients who do get the brand name drug from Canada and have had good success with that at an affordable price. Not as cheap as if the insurance was paying for it, but certainly doable for the people in my practice that are doing that. That being said, also wanted to let y'all know I am teaching tonight at 19550 Restaurant Row. That's I-10 and Fry Road in Katy. We dance at 7 p.m. Would love y'all to come out and dance. You know, I'm always talking about exercise, and aerobic exercise is a good, healthy way to take care of your body. So I'd like to see y'all doing that. And feel free to message me if you need a free pass to come out and jam with me tonight. Okay, guys? This is Houston's dancing psychiatrist, Dr. Barry G. Hoping y'all have a great day. I might post something else a little bit later. If not, tomorrow's another day. And y'all have a blessed one, okay? Take care.